Hello, my name is Kathy Andresen, and I'm a student in the Masters of Public Health program at St. Ambrose University. I'm going to be presenting on the human papillomavirus, HPV, vaccine access and describing that it is a public health problem that needs attention, and there's evidence-based solutions that can help alleviate this problem. So the objectives of this presentation are to, first of all, introduce the HPV prevention as a public health issue and identify there's a public health impact of HPV prevention, explore the barriers to access for HPV prevention, discuss evidence-based solutions for addressing access barriers, and finally, evaluating outcomes for HPV access. So the problem, an overview of HPV, human papillomavirus causes cervical cancer. Worldwide, it is the second most common cancer in women, second only to breast cancer, according to the World Health Organization. HPV is primarily transmitted through sexual contact, and the primary method of prevention is through vaccination. There are a couple vaccines available, and they are recommended for adolescents ages 11 to 12. So, according to the National Cancer Institute, HPV vaccination has the potential to reduce cervical cancer incidence around the world by as much as 90%. So knowing that there's a vaccine that is available and is preventable is key to this project and presentation. However, despite the availability of the vaccine, and it is a pandemic issue, the rates of vaccine vary according to Walker and al. There's an inconsistent ability for individuals and populations to access the vaccine. And in the United States alone, the rates of HPV vaccination vary based upon a number of variables, socioeconomic status, gender, region, and especially in rural populations. So this is an issue. Communication from healthcare providers is the most significant influence and also barrier for HPV vaccination access. While healthcare providers are in a key position to recommend vaccination, they oftentimes under-recommend HPV vaccine compared to other age-appropriate vaccinations. They tend to overestimate the rate of vaccine administration through self-report. So many clinics have vaccine registries in which they input the vaccines that are given, and they report that they have a higher rate than they actually do. So that is also a barrier. So HPV prevention access can be resolved through three major interventions, and these are evidence-based solutions. One is AFIX, and we're going to talk a little bit more about that on the next slide, explain that, education, and then also policy. And so this is an example of a recommendation that there's a very low risk of exposure to HPV before age 13, but the risk of exposure increases thereafter. So the best method is to vaccinate preteens before they are at risk. So AFIX stands for Assessment, Feedback, Incentives, and Exchange. And this is a program through the Center for Disease Control and Prevention that is available for providers nationwide. And so how it works is that providers sign up for this program, AFIX, and then it's multifaceted, but they actually help to review provider state registries and then track rates of the vaccine in those clinics. And this is really used to start at the provider level so they can really assess their own clinic's vaccination status so they can determine how to proceed from there. And then the overall goal would be that clinics that need education would be able to effectively be identified and essentially improve their outcomes based upon this process. So another aspect of this prevention that's evidence-based is education. Healthcare provider education is targeted primarily at communicating with the parent and guardian. And it's been evidenced by multiple sources that the provider is a great influence on um, parent and guardian decision making when it comes to vaccinations. But what they're finding is that providers are under recommending HPV compared to other age appropriate vaccines. Another avenue of education is social media to communicate appropriate need for HPV vaccine. So this sample on the right is an example of a targeted campaign used by the CDC for parents and guardians, and saying if there were a vaccine against cancer, wouldn't you get it for your kids? And essentially that's what the HPV vaccine is for. So it's trying to bring to light more information for parents and guardians about why children are being vaccinated at age 11 to 12. A third intervention is policy. So as we've learned in this class so far, the interventional policy is widespread and essential. And at this point, in 2018, there are 3 states that require HPV mandates for children in secondary schools. This map is an illustration from just 3 years ago, and at that point there was only 1. But now there's 3. But that compares to all 50 states that require Tdap, and then 39 states that require meningitis vaccination, both for age 11 to 12 year old children. So the idea would be to get more states to mandate vaccines in an effort to increase the immunization rate of HPV in those states, because it has been evidence that those states that require vaccines have an overall higher rate of vaccination, even though there are some states that you can opt out for various reasons, but overall that is the goal. So how would the outcomes be evaluated for HPV vaccine access? Well, first of all, the number of vaccines distributed to clinics could be monitored, and then actually through the registries, through the AFIX, could determine if the children ages 11 to 12 are receiving the vaccine. Because at this point, the vaccine distribution alone does not fully indicate who is receiving those vaccines. And then the second aspect of evaluation would be the number of providers receiving education related to communicating recommended vaccines. And there are a lot of resources out there for providers to talk to their patients and families about recommending vaccines. And then the third evaluative method would be to determine policy change through monitoring of states enacting rules related to mandated HPV vaccination. So in summary, cancer is caused by HPV and it can be prevented. So cervical cancer can be prevented through vaccination. It would require multifaceted public health interventions, which are seriously needed to make a widespread change in this public health issue. And overall, an upstream approach to addressing this public health issue is needed through um, encouraging providers to really evaluate their practice and recognize the influence that they have on decisions made by parents and guardians that ultimately impact patients later in life. Here are my references.